The story of Fotona began in 1964, and this is just 4 years after the invention of the very first laser. Starting in the range of industry, rangefinders for defense, and also optical communications. And in early 80s, Fotona developed its first medical laser, and it was for ophthalmology. But in 2004, Fotona actually started to refocusing all its strength and capacity from the defense and the industry and optical communication all into the medicine. And here we are today, covering really a variety of different specialities in the medical field, from aesthetic and dermatology, gynecology, ENT, ear, nose, throat, physical therapy, recent added field, male's health and proctology, and of course, dentistry. This is the field that we are here for today. Do you hear me okay? Do you hear me okay? Okay.
Yes, perfectly fine, Saša.
Okay. I always like to share this information with all my audience, that our mission at Fotona is very simple and very clear: to stay the most respected global medical company in this field. Why I like to share this? Because out of this focus comes the action of Fotona, that we are very, very connected on medical field on the globe with research institutes, universities, and this is actually the basis that we develop very safe and efficient applications and treatment protocols. And based to this, our mission and focus, in 2007, we've developed Laser and Health Academy. Jitendra also mentioned this already in the beginning, at the introduction, but we are very, very proud of this institute, of this academy, because clearly it is a foundation of all the science-based research that we do at Fotona. And I would like to share this video with you so that you come to Laser and Health Academy Institute headquarters to join our people, to join our community of sharing knowledge and experiences, and take a look.
The effort that Fotona made to build this facility is huge, but it's going to be worthwhile. Nowadays, we cannot ignore the potential of the laser medicine for the quality of life and health care of our patients.
Of course, in the same place, we have a lot of people who are working on different fields in the laser industry.
The LAHA Institute is the educational center for laser dentistry worldwide. It's focused on the highest level of education we can offer to everybody. Fotona is great for this. It's really, we chose perfection, not only for the technology, but also for the organization.
So here the magic starts. And now I would like to share with you the information about Fotona dental line. So we offer the most advanced, ultimate all-in-one hard and soft tissue laser, LightWalker on your left side, and advanced technology Sky Pulse dental laser, which is a little bit lower power compared to LightWalker and have some different technological solutions compared to LightWalker. But today, Jitendra asked me to focus on LightWalker, which really is one of the best options that dentists can choose. You have listed all the indications, all the applicational field that LightWalker. Sorry?
Continue.
Okay. So you can do conservative endodontics, periodontics, implantology, soft and hard tissue surgery, and of course also what really counts on this dental laser system are applications that are beyond dentistry. So you can also add some aesthetic application, anti-snoring treatment, and photobiomodulation. I believe that Dr. Nitish will speak also about photobiomodulation, that it's really very, very popular and efficient indication in dentistry and in medicine in general. So the LightWalker, the technology, what are the unique characteristics of Fotona technology that I can share with you today? These are for definitely pulse duration. The effect, what kind of effect the laser light will have on the tissue depends on many parameters. One of them is the wavelength of the laser light, and the second biggest parameter is the pulse duration. At Fotona, we developed a very broad range of pulse duration, which means that you can work with very, very short pulses, so short-term pulses, which can have very, very high efficacy for cutting and are cold, so you cannot overheat the tissue, or you can choose a very long pulse durations for more thermal procedures. The efficacy of cutting is reduced in the longer pulse durations, but you can deliver some heat in terms of coagulation and disinfection. So you can, with choosing different parameters, you can decide what kind of effect your laser light will have on the tissue. Other parameters, other technological innovations in the LightWalker. Definitely highest power that dental laser can give you. 20 watts of power. This is a maximum on the market. This is the max mode. Then we have a very more than several, I would say, several pulse modalities that are very unique, that are consist of train of pulses, and each of them serve in its own field of applications. For example, sweeps. Remember, the word sweeps is for making bubbling effect inside the liquid. that we can use it for disinfection and cleaning inside the root canal and in other cavities in the oral cavity. For example, after extraction of the tooth, after cyst removal. So whenever you have some sort of cavity that needs to be cleaned and disinfected, you can use the power of bubbles. We will go more in depth later on. Then we have QSP, quantum square pulse. QSP is a modality that is developed for hard tissue ablation. It is very cold modality. You know that when treating hard tissue, you need to be cold, not overheat either the pulp or the bone. So we developed that kind of modality that is composed of train of pulses that are delivered on the tissue with some sort of pauses in between the pulses, so that the tissue can cool down and that we avoid this debris cloud that appeared after the ablating hard tissue. So remember, QSP for hard tissue, either for conservative dentistry. Yes. Any problem?
All good, please go on.
Okay. Another very unique modality is smooth. Smooth is a very, very long pulse duration that actually hits the tissue, warming, we are warming the tissue, and is applicable either for skin or the mucosa. And the outcome of this treatment with smooth modality is shrinkage of the tissue and the producing or inducing neocollagenesis. And let's start with endodontics and sweeps. If you observe this video on your right side, you will see that with delivering the laser light, erbium light, inside the irrigation in the root canal, we can produce bubbles. We are actually inducing cavitation inside the root canal, inside the irrigant in the root canal. And these bubbles are constantly growing and imploding, and they're accumulating the energy out of this cycle, bubble cycle. And when they finally implode in itself, they release a lot of energy that transfer into the waves inside the irrigant. And these waves are delivering the hypochlorite or EDTA inside the root canal down to the apex, all lateral canals, into the tubules, in all irregularities inside the root canal that you can imagine. We are staying for the irrigation in the coronal part of the tooth. We do not need to enter in the specific canal down to the apex to irrigate the canals, to clean, to disinfect. We are staying just in the chamber, and bubbles and waves do the job. On the right side, you can see this bubbling effect on the real tooth, and you will be able to observe how these bubbles are actually mechanically pushing throughout the canal down to the apex and cleaning inside the root canal. I can show you also on the left side how it works in more microscopically. So we are creating bubbles because the wavelength that we are using with sweeps is erbium wavelength. This wavelength is absorbed in water. And because of very, very high absorption, these bubbles are creating, and we are doing this, we are making this streaming of the liquid. Inside the LightWalker, all is prepared for you. You do not need to calculate what kind of parameter you will use for each tooth separately. You will just choose the main field that you work with. So example, endodontics, sweeps, or pain management or aesthetics, but now we are in the field of endodontics. So you choose sweeps icon, and then you get opened this field of tooth types. And you choose which kind of tooth you will treat. And the system itself automatically preset you the right parameters. And you just start to irrigate. Dentists are actually really thrilled about the sweeps technology because it's very, very easy, safe, and efficient. Although these kind of very difficult cases to treat with sweeps, you came to this kind of pristine results. The next field is periodontal and peri-implantitis treatment. I didn't mention at the beginning that on LightWalker machine itself, you have the possibility to have two wavelengths integrated in one machine, erbium YAG and neodymium YAG. These two wavelengths are very, very different, totally different in its physical properties and effects that they have on tissue, but they are extremely complementary. Erbium YAG, so one of the wavelengths is absorbed in water, and the other wavelength is absorbed in pigments, in melanin, hemoglobin. The wavelength that is absorbed in water can treat any kind of tissue because water is our body. All our tissues contain water. That's why with erbium that is absorbed in water, you can treat everything, any kind of tissue. Because it's so well absorbed, it is superficial. You cannot penetrate very deep into the tissue. On the other hand, we have neodymium YAG, which is absorbed in pigments. It is less absorbed. The absorption in pigments is less pronounced, less deep compared to erbium into the tissue. That's why it is very, very good for deep disinfection, deep penetration, and also for coagulation. So we have deep penetrating, a superficial wavelength that is very, very good for cutting. It is very suitable for hard tissue. And on the other hand, one wavelength that is very good for deep disinfection and coagulation. And when you put those two wavelengths together, you have a perfect combination. And that's how we composed a lot of our treatment protocols, to combine both of these wavelengths, to have the best of both worlds. It is also in the case of periodontal and peri-implantitis treatment. We know that the main problem in the case of periodontitis and peri-implantitis is the biofilm. So in the first place, we need to remove the biofilm on the root surface, also remove the diseased necrotic tissue, soft tissue, also necrotic bone, and disinfect the area, disinfect the periodontal pocket, disinfect the peri-implant pocket. That's why we use the combination of both wavelengths. For example, in the case of treating periodontitis, we first use deeply penetrating, disinfecting neodymium YAG to remove the diseased epithelial lining, to actually make an access to the root surface that we need to clean in the second step. When we clean hard tissues, when we ablate hard tissues, we always use erbium, that is superficial, that is cold wavelength, that we do not overheat the hard tissue, in that case, the root surface. And at the end, when we have cleaned the root surface, when we have removed the necrotic tissue, we do the deep disinfection and we make a stable fibrin clot. We actually seal the periodontal pocket so that the bacteria from the saliva, from the oral cavity, do not enter right away inside the healing periodontal pocket. This is very important, what I would like to share you now. So it's not just how we do it. It also what is the outcome of the treatment. It's not just that the procedures are simple, that we only use one tool with changing parameters. We can do the modification of soft and hard tissue. It's also the importance of stimulation, modulation. It was demonstrated, this is science-based fact, that with the combination of neodymium and erbium, we can stimulate the fibroblasts to much higher extent compared to curettes or just using one wavelength. So the combination of neodymium and erbium wavelength in periodontal therapy stimulates periodontal fibroblasts, which at the end results in faster and better reattachment. And this is the actually goal of all periodontal therapy. The next fact, scientific proof, the concentration of endotoxins in the cementum after periodontal therapy is much, much lower when you compare with different other techniques of periodontal treatment. So this is how to say, this shows you that the therapy actually disinfects, which is again a very, very needed step in the case of periodontal treatment. You can scan this QR code to read the laser protocol for peri-implantitis treatment. Okay, peri-implantitis treatment actually has no great alternative. We all know that even combining of different classical therapeutical approaches for peri-implantitis, it's not so successful as we would wish. That's why we are always searching for new treatment approaches, new treatment protocol for better outcome of peri-implantitis treatment. And for example, in the case of laser, there are several benefits. The first one is that at the beginning of the peri-implant disease, either is this peri-implant mucositis or first stage of peri-implantitis, you can try to resolve the problem non-invasively. You can do it without surgical, without surgery, actually without raising the flap and doing the thorough cleaning and disinfection. This is quite nice solution for general practitioners that do not use surgical procedures routinely in their practice, but for sure, for first step of peri-implantitis, a minimally invasive treatment without surgery with laser therapy. Laser light can reach areas that cannot be reached with mechanical instruments. The other benefit in the case of peri-implantitis treatment, for sure, are that erbium laser, erbium wavelength, it's very, very safe and efficient for direct cleaning of the implant. This is a very nasty case of peri-implantitis, but I would like to show you how actually the laser light removes directly the biofilm and hard concrements directly on the implant itself without damaging, without changing the structure of the implant. Laser light is absorbed in water, and the biofilm and hard concrements on the implant itself are composed 90% is water. 90% of the biofilm is water. So this is the first wavelength for direct removing of the biofilm. Third benefit of the laser treatment of peri-implantitis. Biofilm does not emerge just inside, we all know, just inside the root canal. They emerge on the root surface in the case of periodontal diseases. Also on the implant itself in the case of peri-implantitis treatment. And think, if we can treat the endodontic diseases, so if we can clean root canals, why we cannot clean inside the periodontal and peri-implant pocket also with bubbles? I explained to you how we clean the root canals. We're just inserting the fiber tip in the coronal part and making bubbles inside the root canal. And now we are trying to develop a method how we could, with the effect of bubbles, clean also the periodontal and peri-implant pocket. In that case, we could treat also severe grades of peri-implantitis and periodontitis without opening the flap. Inserting the fiber tip 2 millimeters up front inside the periodontal and peri-implant pocket and let the bubbles do the job. This is the simulation out of the PDMS membrane. It's an artificial membrane, but it's similar hardnesses like periodontal and peri-implant pocket. And you can see that we can create this kind of cavitation, the bubbling effect also inside the periodontal and peri-implant pocket. And now on Laha Institute, we are developing that kind of procedures. This is from Lin Nguyen. The case report, she actually combined this direct twin light treatment of periodontal, severe periodontitis, so with combining ablating procedures with adding bubbling effect inside the periodontal pocket, and she reported great results after this case. I already mentioned we can use bubbling effect also in any other cavities inside the oral cavity, after the extraction of the tooth, after the cyst removal, many different situations that you can use. Immediate implantation. LightWalker is perfect for bone cleaning and disinfection because you can use either very cold superficial bone ablation with the laser, or deep disinfection with neodymium. I would like to, okay, sorry. And this is one application that is very modern and popular in dentistry. And actually, laser can give you the way of working that has no alternative. Because, for example, you can debond from the natural tooth or from the implant abutment, either the crown or the veneer or the whole bridge. We are irradiating with the erbium light. So that one that is absorbed in water above the veneer, under the veneer, and erbium light is absorbed in the bonding agent that, did you see? The veneer, the whole intact veneer popped down from the tooth. So we can reuse it. And also the bracket, orthodontic bracket, it's 1 second and you remove the bracket. And you can use it with a little bit more time also for the bridge. You can remove the intact bridge. A high power of LightWalker allows you to do a very efficient and fast hard tissue surgery. This is one example of our friend, our dentist, Jason Peng from Australia. In this case, you can see actually how one wavelength, this is erbium wavelength, can work on soft tissue, hard tissue, bone, and tooth. This is the example of precise surgical extraction with laser. The benefit of laser surgery is also that we have no mechanical or thermal trauma of the tissue, so that the healing and downtime after the treatment is very reduced compared to classical instrumentation. There are a lot of different conservative treatments, solutions. For example, what are the benefits if you compare the laser and the classical curettes for cavities prep, for caries removal? I believe that Dr. Nitish will address this subject, so I will just briefly no smear layer, disinfection, open dentinal tubules, surface conditioning of the tooth, and many, many more. But you will see, I believe, a lot of case reports with Dr. Nitish. I know that he's passionate about the conservative treatment. Soft tissue surgeries. There are indications that absolutely laser has no other alternatives. For example, hemangioma removal. There is no surgical procedure in this kind of treatment. You use neodymium YAG, so the other wavelength, not the ablational wavelength, the erbium wavelength, but the one that is absorbed in pigments, in melanin, in hemoglobin. And you actually, the absorption takes place inside these venous malformations inside the hemangioma, and there is actually a shrinkage right away after the treatment, and the body after the treatment resorbs these malformations, and the results are very, very nice. Depigmentation, you can either use erbium or neodymium. With erbium, you are ablating layer by layer pigmented tissue under you reach non-pigmented one, or you choose neodymium wavelength so that this wavelength is absorbed directly in the pigments, and is very similar reaction compared to vascular malformations, a similar reaction of the tissue. Photobiomodulation. This is also one subject that will be addressed, I believe, with Dr. Nitish. He's passionate about this also. Just briefly, a theory behind the photobiomodulation. This is a treatment that we use in different kinds of medical fields. We use a very, very low settings, and we use the wavelengths from different kind of wavelengths, laser wavelengths, and we are actually stimulating mitochondria inside the cells to produce more ATP. You know, the ATP molecule is like a fuel for all the processes that inside the cell, and consequently for the whole action of the body. So we are stimulating the production of ATP, we are stimulating the optimal production of reactive oxygen species, and we are stimulating the optimal production of nitric oxide. And what we gain out of this? We gain faster healing. We gain less edema. We gain less pain. We gain faster wound healing. So a lot of this aspect that we need to cherish this kind of treatment after each surgical procedure. For example, if we are talking about dental procedures, then for painful situation, when your patient is in pain, when we need to fasten the recovery. So a lot of things, very good also for mucositis. This is one of the indications. So the photobiomodulation was accomplished by the official board for chemotherapy-induced mucositis. So it is an official treatment for either for chemo or irradiation-induced mucositis, and we have also scientific published articles about this. Very good treatment. And at the beginning, this is my last few slides. At the beginning, I said that a great value of LightWalker are also the indications that you can do beyond dentistry, and these are aesthetic indication. Let's see a little bit out of what kind of aesthetic we can do. Again, with combining both wavelengths, we can do rejuvenational treatment of the face. We can do, these are very minimally invasive, with very low downtime, very natural appearing indications. It's not like that you are using fillers or Botox, but very natural looking, nice, very with good results. For example, lip plumping, skin resurfacing, either after acne or scars. Then we can treat acne. Actually, we can do hair removal. Hair removal is a little bit limited regarding the areas, but on the face, on axillas, bikini is very good. Fibroma removals, vascular lesions treatments, smooth eye, very nice indication for brighter look for these wrinkles around the eyes. Very, very nice. And then NightLase. It's a great addition to dental practice. we are actually just hitting the tissue. It's non-invasive indication, no surgical procedures. We are hitting the tissue. We are making shrinkage of the loose tissue inside the oral cavity. And we are promoting neocollagenesis that actually also shrink the tissue. And the results are good. It's a little bit more on the right selection of the snorers, so the patient, because it is important in which what kind of part the problem is. If you have the problem for snoring inside the nose, you cannot use the NightLase for snoring treatment, but a very nice indication for this is for example the volumetric assessment of patient after the NightLase. You can see how we can enlarge the air volume after the treatment. And this is actually also the a little bit of showing you immediately after the treatment how is the situation inside the oral cavity. These are the courtesy of a different doctor, Dr. Mansilla Toscano, working on NightLase a few years ago. Okay, yes, and now I fastened a little bit because I know that you are waiting for Dr. Nitish. I would just like to invite you, if you decide to become a laser dentist. Education is something that is very, very important, because it's very important to know how to use proper parameters to have exact desirable effect on the tissue that you want to have. And there are so many effects that you can have with one tool. And that's why we developed a very good education program. It is called Laser and Health Academy Master in Laser Dentistry. And Dr. Nitish will actually finish it in a month. And yeah, we will congratulate him very soon. And he can share his experience on this program himself. Thank you very much for listening. I'm open for the question anytime you want. Thank you.
Thank you, Saša. That was a wonderful overview of not only the Fotona company, the Academy, the LightWalker laser, but the volume of applications which are possible with the LightWalker 80 version, the combined and the YAG and beam YAG laser, which we call it the ultimate laser and the widest applications. So I think we will reserve the Q&A for latter half, and we are already at 4 o'clock. 1 hour has elapsed. I would like to invite Dr. Nitish to make his presentation on his experience with the LightWalker. Well, friends, I would like to also inform that Dr. Nitish has been using LightWalker for almost now close to 10 years. And he has recently upgraded, he got his second laser in his clinic, which is the latest version 80, with most of the handpieces which are required to do the dentistry and complete range of applications from dental, aesthetics, and pain management. Over to you, Nitish.
Jitendra sir, just wanted to add, we have very probably he's known on the other side of the continent. He's Dr. Praveen Arne. He's a faculty in University of Buffalo and has done a lot of work in lasers. So yes. I have sent him a request from my side to be a part of this webinar. So he's also there. Probably it's very early in the morning, but thank you, Praveen, for being here. And we also have the dean of the school and the associate deans and the vice principal attending the webinar. Thank you, and looking forward for the webinar from Nitish.
Yeah, thank you and welcome to all. And let me also share, Saša was talking about some slides about Dr. Nguyen Linhan from Australia. She is also on our webinar today. Welcome, Dr. Nguyen Linhan. And there are many colleagues from the Australia also who are attending. So it's connecting all the continents and probably a comfortable time for us. In Australia is going to be night, and for Dr. Praveen, very, very early morning. Thank you for being here today. You know, you are enriching our experience. Thank you so much. Yes, Nitish, please take over.
Thank you very much, Saša. It was really a very enlightening session. You have covered maximum part. And I welcome Dr. Praveen. He's a master of photo biomodulation. I've been following Dr. Praveen from past 10 years, and he is a guy to be listened. I mean, I wish Sir would have been here. He can really talk about photo biomodulation in depth. And I welcome people from Australia. Lynn, she is a fantastic teacher for aesthetics and dentistry too. Anytime you get a time to listen, Lynn, she is awesome. She is awesome. So coming back to my topic, I pray to, God, what I am telling you right now is my clinical experience. So what Saša has told you is about in depth about how laser works. She was covering all the round. Frankly speaking, guys, this 2 hours or 1 day is not enough. It's a journey. This is what I learned. And while speaking, while talking, I will also learn many things. I've learned many things from Saša, and still journey is on. So coming back to the topic, is laser really a magical investment? See, I'm a clinician. I will share you my experience, why I started this journey and how I'm moving ahead with all these hurdles, and these people, teachers are helping me to get out of this hurdles and move towards my journey. So this is my journey, a small setup of all these lasers, and team Mikro helps me to accumulate all these things. People like team Fotona, teachers, they all help me how to go ahead with the journey. So coming back, why do we require lasers exactly? We know how we work. We know what exactly we are doing. Do we really know why we require lasers? This why, once you know, I think so the things are settled in your brain. What wavelength you required, what company you need to attach, what exactly you are planning to do. So this why has to be answered by exactly what you want to attain. A small slide can tell you, see, it's a light. See, laser is a light. Now, if you start firing this laser light for a longer duration and you start using different wavelengths, something else will happen. So light has to interact to do something. It has to either it will warm the tissue or you will vaporize the tissue. So you should know exactly what you are planning to do. This is what LAHA is about. LAHA basically, I'm telling you, hardly matters what sort of accreditation I've earned, to whom I've listened. Still, I'm learning. You know, every patient is a new learning patient for me. This gives me new settings actually. And so you can bring your own settings, but at least start the journey. So at last, you should know what exactly you are designed to do. Like if I talk about warming effect, if you go below this, you can do photo biomodulation. You can vaporize the tissue when you start using earthing for cutting act. So this why has to be answered whenever you plan to use lasers. One thing I want to tell you, what we have been told and educated in a graduation and post-graduation is to use a scalpel and a blade or a burr. Laser is totally different. You need to wait time for the energy to work. Be patient, be slow. It can become a magical tool. Now say this video. I have incorporated all the wavelength in this short video. I've used YAG laser, I've used 445 nanometer laser, I've used 1064 Nd:YAG laser, and an 810 nanometer laser. All these three diodes I'm using at 0.5 watt. And you can see what this energy is doing. You can see the depth in which the energy is going and see what I'm doing with the erbium. Erbium means like it's very gentle. It's superficially absorbed. it always removes the tissue layer by layer. But if why? Because it is a layer to be, or laser or energy to be absorbed by the superficial surface. Now, if you talk about Nd:YAG, it is deeply absorbed, as what Saša was telling you. Basically, we need chromophores to be absorbed. So it's a journey of my, I'm lasing light for 16 years and it's too short. As Jitinji told, recently we got an opportunity to represent India, and I'm really blessed. I met all the teachers, my colleagues, Praveen sir, Saša, team Mikro, Len, Jason. We're really happy, and we got this appreciation and recognition for India, and I learned a lot. And of course, Laha, fantastic academy where you tend to learn in depth about laser, not about Fotona. We always take a holistic approach to educate you, to make you a laser dentist. And this is how the seminars and the forums conducted. You can do online. This was a COVID time when we joined that. And of course, here is Praveen sir and all these teachers who taught me photobiomodulation, who taught me different wavelength, how it has to be used, and here I'm standing right now. So coming to the topic, it's laser. Laser, what is? It's a light amplified by stimulated emissions of radiations. And if I put this radiation out, don't worry, it's not radiation. You are not radiating anything. This is what people used to ask me. Will it give me cancer? Will it give me something else? You know, I spoiled 8 to 10 cases in my life, and that was an instant where I started learning. Because before that, I was thinking laser is easy to use. We buy a box, you get a CD or a booklet that we sometimes see, sometimes we never see, and we started working it just like a blade or just like a bird. That is wrong. You need to learn, and it's an endless journey. Of course, as you learn, as you grow, as you get the right teacher, you start refining your skills. So I don't think so in today's time any part of the life that is not left, that is not touched by lasers. Same with the medicine. You talk about neuro, you talk about ENT, you talk about pulmonology, gastology, oncology, angioplasty, and why not dentistry? Why we need to think twice? Why we need to think that DCI will give a clearance or not? We should. See, I'm a clinician. I'm trying to just bridge this gap, because I'm not a academician or a researcher, but I will tell you what I have seen in my clinical practice and how it is working. If I can work, everybody can work. So every perspective of life is touched by lasers. Lasers means precision. See, in after, even before COVID also, but after COVID, we know that we all have limited time to work. In that time, if you start giving precise work, that is drugless, drillless, and sutureless, that can give you a desired result, I think so, you can become a best dentist. This is what laser is. I'm removing this wart with the erbium YAG laser. If a patient comes to you and says, "Doctor, remove it," I can't do such a refined surgery with the help of blade. It's not possible. I'm a general practitioner. I can't afford to see the blood and do all these things. Patient wants a good service, and this is what precision laser can give me. And why erbium? Answer I will give you right now. So all lasers are electromagnetic spectrum. So it starts from visible to infrared. They are not non-ionizing. My words, these are not radiations. There's a myth, and this myth we have to, because we always live in our own brain, having our own ideas. Start experimenting in yourself. Start seeing things. Start listening lectures. Actually, these are not at all radiations. These are non-ionizing radiations. They are not ionizing radiations. Now, what we need to do, what exactly we are looking for a desired result. So laser light has to be absorbed. There are three things that will do: either transmit light, it will be absorbed, it will be diffused or reflected. We need absorption so that we can get the desired result. And where the absorption will happen, we need to, the absorption of light has to happen somewhere. It has to be absorbed by chromophores. So this defines which wavelength is affecting which chromophores, so that we can have chemical, physical, and thermal changes. And this energy travels at different wavelengths and absorbed by the target tissue. So this is what I tell you. You should know why we are using lasers. So different lasers are absorbed at varying wavelengths. So if you talk about erbium YAG laser, as Saša was telling, it is more absorbed by water and hydroxide. You talk about ND-YAG, you talk about diode, it is more absorbed by melanin and hemoglobin. So you need to know which wavelength you want and what is your desired target actually. So coming to this, say this, in this 2 slides or 2 videos what I have recorded, I am troughing. Now my main purpose was just to see this class 5. But to see this class 5, I can use diode also, I can use erbium also. But the biggest advantage of using erbium was sometimes you never know that the gingival troughing has to be 2 millimeter or 3 millimeter. Because, and with the erbium, you are pretty sure that by chance you are touching bone or you have to do a bit of crown lengthening, you are very safe. You can't do this crown lengthening with the help of diode. It's next to impossible because the chromophores are not right for the diode to be used on a bone. Diode loves melanin. Diode loves blood. And what erbium loves is water. And you can see how refinedly I was able to remove this gingival sulcus. There lies the importance of knowing what we want to do. And we should always have an instrument that is versatile. That's what erbium is. So, taking it too short, I want to come directly to my clinical cases, what I'm doing in my clinical practice. I try to touch all the areas and I will tell you how I'm working and why I love using erbium. Case first, if this type of patient comes to your office, what is the line of action? Of course, pull out the tooth and go for implants. No. Being a clinician, I always say give a second chance to the life. Don't be too fast. Don't be too fast. Once you have instruments, armamentarium, and bit of knowledge, now you can start opening your minds. There's another alternative. Why don't we go for a crown lengthening, root canal, crown lengthening, and capping of a restoration? We can, of course, possible. Now see, this is what we did. We first started this crown lengthening. I want to see what was the area of a tooth that was left. We did a root canal, and this is the response what we got. After saying this response, always you first start believing in yourself. Patient will believe because that belief is seen in your eyes. This is what I'm doing. Once I start believing this can happen, patient has to believe. There is no option that it will happen, it will not happen. But you have to be really confident. For these things, education and training is really required. And this is how the crown preparation was done. And we used ND-YAG and erbium both, where bleeding was supposed to be stopped and some hypertrophic tissue was there, we use erbium, NDX, sorry, where the bone crown lengthening was required and bit of connective tissue was there, we use erbium. This is how the combination of laser was used. And you can really appreciate laser heals. This is what Saša told you recently, that what photobiomodulation is. It's a simple process of photosynthesis. You put your plant in sunlight, it always gets the light. You put it inside in your room or in a dark room, it loses the life. This is what we have seen. You can see after placing this CERAC crown, what would have happened if I use a blade? Of course, it would have regenerated, but it would have been a tough journey for me. See, being a clinician, I have less time. I need a high-end technology so that I can serve my patient in a better way, and I want a hassle-free dentistry with a long-lasting results, plus a second option for my life. This is what we got. Now, we always say, you take care of your hygiene, you take care of your tooth, you take care of your biting habits. Don't do this thing again. But if something went wrong, you have one more option left. At any time of my life, I can convert these cases in surgery. But why to do surgery? If forget about dental surgeon, if you are a patient, what you will do? Will you go for implants? We all know now we have immense evidences that implant dentistry is going ahead, but more peri-implanted cases are also there actually. Once it happens, it's difficult to handle. Difficult to handle. And this is how it was seen. From back, because we always see the patient from front. Try to, because see, these things are for me, to make me confident, to make me feel proud in myself that, okay, I can do. If I can do, everybody can do that. And again, I'm telling you, I'm a clinician. I do it, I do a lot. And this recording I've done from past 14 years, I do it only for myself. I'm feeling really proud. I was not aware that these recording will serve me in this way. These are the things that happens to me daily. Another case. Say this, what you will do? Root canal, patient was in pain. Immense sensitivity was there. Immense sensitivity was there. But patient really want to avoid root canal. Once you start doing these cases, patients start believing you. Patient says, doctor, can you do something without root canal? And see this video. Once I start firing YAG laser, you can really appreciate I was able to open those hidden patent fissures areas actually where the bacteria was accumulating. See that? It's possible. I can become more conservative. This is what I did. After pulp capping, I started conserving this tooth. And this was the result, what we got. At any time, I can convert this in root canal and capping. But why? It's a single visit dentistry. We don't have time. We have to be precise. We can sterile. We can take care of the tooth. See, at last, whenever a patient comes to my office and in anybody's office, the tooth is maximum spoiled. At that time, if you are not using technology, it will definitely convert in MSC status. Another example of frenectomy, a small child. She was so scared that they never want to, because whatever option, she was not comfortable to sit first in a dental chair. My colleague, they were ready to do this frenectomy, but they gave the option of a blade or a scissor. Whereas my child, will I do these things? No, not at all. Not at all. So we first calmed the child. She was really comfortable once because I showed her, see, this is how laser works actually. Okay, first of all, she was away from all these funny instruments, PP blade and all these things. We started the journey. We use YAG laser. And you can really see in this video, erbium works layer by layer, layer by layer. You can see exactly. Don't be too fast. Reason being is you have to be slow. The energy has to be absorbed. Don't be too fast while using lasers. And as Saša has told you, it's a combination of lasers. Reason being is once erbium is absorbed by water, the water can be in your blood vessels also. It can burst. Now, how to control that bleeding? There comes the role of Nd:YAG laser. I'm blessed to have this Fotona because now it has two wavelengths. They always give you two wavelength Fotona LightWalker. This is one is Nd:YAG, another one is YAG. The beauty of erbium is that as it is superficially absorbed, the healing is much faster as compared to Nd:YAG. But where you require disinfectant, where you really want to control bleeding, where you feel that you need to remove the bacteria, of course, Nd:YAG is always having the upper hand, especially in paleo cases. You can appreciate how the healing started. No suturing. We did biostimulation, photobiomodulation. I was not having that big Marco or Geneva handpiece at that time. I used Nd:YAG 300 micron fiber, just 5 or 6 millimeter away. I started lasing that surface very gently. In lasers, your hand movements matter a lot. It is because you, for example, if I'm using 0.5 watt, my colleague can work in 0.2 watt also, and my colleague can work in 1 watt also. It depends how fast and how slow you're moving your instrument, where exactly you are firing your laser energy. All these things matters a lot. And this is how the final result was seen. You can appreciate everything is back. Now she want other treatment to be done. You gain confidence in the patient. Patient become comfortable. And take my words, only we gave her Calpol. That's it. No antibiotic. Nothing is required. Take care if your surgical skills are fine, if you are taking care of this infection, nature knows how to heal. This is the beauty of lasers. It's a respectful way of giving injury. Of course, we are giving injury only. We are doing things just to get the desired result, but it's always a respectful way to give injury. Another case. This is a cancer patient. As you can appreciate, she had a big swelling there. She went for radiations, and after radiations, what happened? This area was not healing at all, and she was referred to my clinic. As people started recognizing, they are knowing that I'm using laser. They asked that, can you help me with this patient because she is under radiation, still going on. There was a spicule. Way back long, some extraction was done, and after radiation, it was exposed. And because of this spicule, she was having some ulceration in the lower border of the tongue. Of course, I can't use Nd:YAG, it is deeply absorbed. Now, here comes the rule. I can't use diode also. Erbium was a fantastic wavelength that I used, and see slowly, because it's an all tissue laser. It loves water. Water is there in bone, water is there in tissue, water is in every part of the body. And the best part is it always removes the tissue layer by layer. It's not so harsh. But, and you will take time. Don't see, in lasers, never be fast. Be slow. Let the energy be absorbed. And you can see how the healing was seen. In a cancer patient, can you believe that? It's possible. Again, no medicine. Reason being is that if a system is really spoiled, I always say you take antibiotic. But if system is fine, why you want to screw a patient again with more poison? Why? Give some time for healing actually. Respect the areas. In all or in maximum of my cases, I use photobiomodulation. What something is left is taken care by the body. With photobiomodulation, we always initiate the healing. This is a right example. Say this. A huge periapical pathology was seen in this socket. Huge periapical pathology. Very difficult. Because the patient want implant, but can you think of placing implant in such a huge periapical pathology? And this is how the socket was cleaned. But after cleaning the socket, we use Nd:YAG laser for photobiomodulation. Nothing else. We fired inside that socket, a huge cavity. We fired from the buccal area, from the lingual area, and of course, curettage was done properly, and then we placed PRF. And you can appreciate how much pathology was removed. And only photobiomodulation, nothing else, and a PRF. No grafting was done. And gently suturing was done, you can see. After 6 months, this is a photograph of after 6 months, patient came back again. We took at least, we give 6 sessions for photobiomodulation. We recalled the patient after 3 months, and after 6 months, you can appreciate the bone that was formed. It's possible. It was eye-opening for me that without grafting, this bone can come back. It's possible. You respect. And this is what photobiomodulation and a PRF and a combination has done for me. This was a CBCT taken out. Can I appreciate the amount of pathology and a post-op? It's possible. It's possible. Now, as you grow, you start taking challenges. Patient want more. This was a hemangioma multiple times because of a ill-fitting crown. Patient was, it was happening again and again, and patient was applying, as we know, locally anxiety or some steroid, something else, and because of that, he started developing candidiasis. Another thing started actually, but the problem was still there. Now here comes the versatility of this laser Fotona. You can see, as Saša has shown you, one case of tongue hemangioma, you can't use erbium. Erbium loves water. You start firing laser, erbium laser specifically in this area, it will burst. It will be oozing out the blood. Now the right type of wavelength is NDR. Of course, you can use other diode also, but NDR work much precisely and you are very safe. Here we used 4 watt, 25 hertz, but we took time. If you can see, I was very slow and very gentle. Your hand movements matter. This is what you need to learn with the laser. Same with biostimulation. You should know how perpendicular, how precise you are firing the laser. Be slow, be gentle, let the light work. So slowly, as the laser light was getting absorbed, the blood was started coagulating. There was something happening. You can see the changes inside this hemangioma. But as I say, be slow. Don't be fast. You need to learn. You need to learn. So the energy has to be delivered in a proper way, in a perpendicular way, in a limited way, so that to see the desired results. And this is how photobiomodulation was done with 660 nanometer handpiece, and finally it was resolved. So in clinical practice, it is possible. Not talking about colleges and also, you can, and it can increase your earning also. You can start taking these type of cases for fibrous growth. Of course, blade is not the answer. Not at all. Blade is not the answer actually. And one more thing, patient want to get it done without anesthesia. One more thing, because as you grow, you start taking challenges more actually. So this is what we did. We use NDR laser just to desensitize the area. We took time. We took time. We used 2.5 watt precisely just around this fibrous growth, and then we only apply a jelly, a YAG Nd jelly around the areas. And slowly, I plugged it with my tweezer and I started firing laser. I would have appreciated if I would have used any instrument that is non-metallic actually, because metals always reflect. Metal always, if you can avoid, it's always fantastic. Mirrors. Now I have changed all my mirrors. So slowly I have changed my whole armamentarium, because of mirrors, your way of daily, your way of carrying other structures, and the photonic energy has to fire precisely. If the work can be done in 1 watt, why to use 2 watt? Be gentle. Let the energy be absorbed, and it works. It's possible. Because I want to reduce with the collateral damage. And as a result, once the collateral damage is reduced, your healing becomes much faster. The down-top healing you are doing. And after this, we biostimulated this area, and this is how the tongue was seen. Another case of conservation. Why don't we try to give a second life to the tooth? It's possible. The patient won't always see, tell the patient the extreme, be ready for implants, be ready for extraction. But once you started using combination of laser wavelength, like Fotona gives you erbium and NDR, you can get the desired results. It's possible. Implant exposure. The best wavelength to expose implant is erbium. The reason being is that, because the erbium is only absorbed by water. If you started using NDR or a diode laser, the energy will get absorbed. And as the tissue bleeds, more energy is getting absorbed. You can't afford bleeding around those implants, because it will heat up your implants and it will impact the osseointegration. This is the biggest reason I love using erbium YAG laser around implants, because it's the best. And as you can see, lot many literature saying erbium is the best wavelength for your peri-implant practice. If you need to disinfect, of course, then comes NDR laser, but it's much safer laser actually. It loves water, it loves your tissue, it respects the tissue in a better way. Can we be so conservative with a burr? It's not possible. Practically, it's not possible. See, patient always come for a single visit dentistry. This 2 mm beam of light can change, it's changing my whole dentistry. I am getting faster and faster day by day. Not how fast I'm getting. Reason being is that I am trying to do a single visit dentistry. Patient love that. And the best part is conservation. Painless. You don't require anything actually. You can do these things. It's possible. Because why it is possible? Because again, we have not used any bar. We use urban YAG laser, precisely remove the carious part, and the urban laser was able to remove ample of tubules so that the bonding effect can be much better and the results can be attained faster. Nice example of this class 4. It's possible. It was a child. It was a boy of 18 or 19 years. He never want to convert these things because he was afraid again of root canal. A patient, forget about implant. Patient says, if you can avoid root canals, of course it is possible. You can, because you know that it's difficult. The most difficult part is to remove the soft caries, because you don't know at what level you can expose the pulp. Though you have CVCTs, you have all the antherium, but when you start working on a practical level, you never know till what extent you have to stop. If it is your tooth, will we do a root canal? No, I don't. Why don't we try? Why don't we become more conservative? It's possible. We can do that. A fibrous growth. This was a pregnant female. Again, she was scared of using blade, and because of some drug, she started having this growth of gums actually. It was so immense that it was socially also it was hampered, but she was not comfortable at all. Now everybody told that it's cancer, because this is what we do. If something can't be done, you just name it something else so that the patient runs. Don't do that. Generate that trust. And we had, and this demarcation, we started the journey with the NDX laser. Slowly we demarcated the area. But here, one thing I did, I was overcharging the area. We increased the power, and this is what is wrong. You should be slow. Why? Because it was bleeding like anything. The overcharging happened because I need to stop those blood vessels. It was profusely bleeding. You can see all the arteries blood supply in this whole fibrous growth. And this is how the result was seen. This is a coagulum, this whitish area, it's a coag. Patient got scared. Doctor, I had abscess. Doctor, I had something as coming on my tooth. No, give time. And photobiomodulation helped me like anything. In maximum of my cases, I'm doing photobiomodulation just to heal the injury much faster, just to reduce all this after effects of the lasers actually. Sometimes we always do increase the energy to get the desired results. Am I audible?
Yes, sir. Please go ahead.
Yeah. So coming to this case of implant exposure. Now there's only one way. We give an incision or we use any punch just to remove the upper tissue of the gingiva. But what I say, try to be slow. Here it's a right example just to tell you and show you that erbium works layer by layer. You can really appreciate how finely the fibers of tissue are coming. See, it's precisely layer by, it's just like you're peeling a skin in microns. If by chance, think of the worst, you're going wrong also, you know, you can just, there's a chance to come back again. But if you use blade, there's no chance to come back. You work on tactile sensation. Lasers never work on tactile sensation. You have to see and work. You have to hear the sound and work. You can never use any of your blade or instrument in such a precise manner. This laser light can be used to trust the gingiva fantastically. And the healing and the downtime for the healing and the post-operative complication is minimum. It's minimum. After this, we went for a connective tissue graft, the buccal area, to get the good keratinized tissue, but the exposure was done precisely without any pain, and healing was fantastic. And here, of course, one thing I want to tell you, can we use diode? I think so, no. Because the gingiva was thick. If I will start using diode, I will start with 0.5 watt, but slowly start increasing the wattage to 0.8, 1.2, 2. Ultimately, we are accumulating the heat around the titanium that leads to the bone loss. So you should know what, why, and where. What is the end result actually? Why erbium? Why not diode? These things you should know. A wart removal. When this female tried to remove the wart with the help of a hair of a horse. And she came to see me because I did her restoration with her laser, and she saw somewhere that laser can be used for aesthetic purpose also. She came to see me because her hair was irritating. When I see the things under magnification, what I saw, there was a big tie. And I asked her, what did she said? Okay, I was just trying to remove the wart with the help of hair actually. This was a horse hair. And here we use YAG laser, only 0.5 watt. But I can do in 1 watt also, 2 watt also. That's not an issue. I want to be precise. I want to reduce the collateral damage, and I need time. I need the energy to be absorbed so that precisely and slowly I can remove the tissue. We gave her a small amount of local anesthesia. You can see this red dot. Reason being is because I want the patient to be calm so that I can work precisely and see. And every hand is different. I'm not saying you can't work with erbium, but diode. Why diode? Because I was worried about the bleeding. If I can use erbium also, but diode Nd:YAG laser that is 1064 was a better option for me than your. Nd:YAG was better option than erbium. The reason being is that it is fantastically absorbed by your melanin, and the chances of bleeding is less in Nd:YAG as compared to erbium YAG. But if you compare the healing, it is much faster in case of your erbium YAG. As Saša told you, apnea. We have done almost 35 cases on about apnea, and this is how the apnea is there. Let me see if it works.
Nitish bhai, no sound in this video.
There is no sound.
No sound.
Recording in progress.
Jitanji, there is no sound of this video.
No, I cannot hear. I think you will have to activate the sound by sharing the screen. That option is there, no?
Yeah, sorry. I'll just share. I'm just playing this video. See, actually, these things makes us and our patient more confident because once you hear it's working.
आज कैसा लग रहा है
It's
आपको ये
audible?
बताइए? मेरे को ब्रीदिंग में तो और इजी लग रहा है, मतलब ऐसा लग रहा है जब बहुत हल्का सा ले रहा हूँ और तो भी पूरी जो लंग्स है वो बढ़ जा रहे हैं.
You feel it is much more comfortable.
बहुत इजी हो गया, बहुत इजी हो गया. मतलब मैं सेकंड टाइम में कह रहा था कि मेरे को एफर्टलेस लग रहा है. थर्ड में और मतलब हर बार ऐसा लग रहा है कि पहली बार से बहुत इजी हो जाता है, बहुत इजी हो जा रहा है.
सो जो अच्छा आपको पहले प्रॉब्लम क्या क्या हो रही थी जो स्लीप अपने को लेकर चलें, वो प्रॉब्लम यू हैविंग?
डॉक्टर साहब देखिए, एक तो मैं मतलब जो स्लीप थी मेरी वो साउंड स्लीप नहीं थी. मतलब मेरे को बहुत बेचैनी रहती थी. और नॉर्मली हो क्या रहा था कि मैं सोता था तो अगर मेरी हैबिट है कि मैं पीठ के बल सोता था पहले, तो मेरे को अपनी हैबिट चेंज करनी पड़ी थी. मेरे को पेट के बल सोना पड़ रहा था, अदरवाइज मैं सो ही नहीं पा रहा था.
ओके.
नींद पूरी नहीं हो रही थी और नींद में मेरे को बहुत बार ऐसा लगता था कि जैसे कुछ अटक गया और आँख खुल जा रही थी.
अच्छा, ये जैसे हमने आपको नाइटलेस थेरेपी दिया,
हाँ जी.
अब कैसा लग रहा है आपको?
अभी तो डॉक्टर साहब मैंने दोबारा ऐसा फील नहीं किया कि मेरे को कभी इस बीच में कभी दोबारा ऐसा कुछ हुआ हो।
चेस्ट कितनी हल्की लग रही है?
बहुत ज़्यादा, बहुत ज़्यादा। मतलब चेस्ट में मेरे को हल्का हल्का पेन रहता था, वो भी अब नोटेबली मैंने कभी नोटिस नहीं किया कि मेरे को कभी पेन लगा हो जरा सा भी।
So this is the effect what we got after third session. As Saša has told you that NightLase laser energy has to be absorbed. It leads to new collagen formation. It's a heat effect, but in a very precise way. And this new collagen, as the heat is emitted slowly, you start seeing response. And in third or a fourth stage, depending on the type of apnea the patient is having, the type of structure you are dealing with, you get the result. But these videos, beside seeing a mouth opening or something, you can go because patient is sometimes we can go wrong while take up for photographs. But what you feel internally cannot go wrong. These videos are really a boosters for marketing and for making you feel that it's working. Reason being is you should know, and believe me, certain cases what we have done after stunt, after stunting, because the patient went to see a cardiologist for some issue, they had other problems. What we have done is we started lasing the area. They are feeling much more comfortable with their chest. Bruxism and sleep apnea, it is correlated. All these things are interrelated, but once you start seeing it works, because these videos are making us more comfortable, and plus it makes patient believe and generates more patient for you. Tongue tie. You can of course use erbium, but I use diode. I use diode here because I was scared to use erbium because it was difficult sometimes to control the bleeding. It works superbly. And believe me, if it's your child, you'll never take a chance. You'll never take a chance with a blade or a scissors. I know it is required. It's done on my chair. It's immediately we have seen. I would have gone more down, but this was more comfortable for the patients. And immediately she was able to take out the tongue. If you say this case, what you will say? This is a young female of 17 years. Young girl, in fact, not female also, young girl. 17 years. Will you go for extraction? No. We simply use YAG laser. We trap the gingiva. We gave 2 or 3 days for healing. We did root canal. It's possible. Again, give a second chance for a tooth to live. Possible. A patient, because of cracked tooth, she was in immense pain. And we use YAG laser. Is that audible, Jitendra ji?
Yes, yes.
Thank you. We took not more than, I think so it was the third cycle when I was using YAG laser, 300 micron, 2 watt, 15 hertz, and MSP mode. But I was very gentle. And this I'm showing you after 15 minutes, not more than that.
Sudhaji, now feel with your tongue. How is it right now?
Oh my.
Better?
Much better.
Swelling is reduced?
Oh yeah, obviously I feel so comfortable.
Comfortable, huh? And previously, before laser, what you were able to felt?
Very dry, very stretch, and little bit pain was there.
Pain was there. Right now, no pain is there.
Nothing.
It's pain reduction and photobiomodulation. What? Again, these are all my dental patients. They want me to do sometimes some heroic activity, and I'm taking challenges. Lynn is making me learn more things. And we use YAG laser. We stretch the area with the help of a tweezer and see. We can really appreciate precisely, very finely. Why do you use ND-YAG? Because healing with YAG is superb. It's really fast, without any side effect, without any collateral damage. The damage, main thing is the damage has to be reduced. This is what we are using erbium for. And of course, biostimulation. If sometime patient has pain, you can take care of the biostimulation. Fungus. Oh, see, it's possible. It's a nail fungus. Use YAG laser to just take care of those fungus in a nail bed. Photobiomodulation. This child just came to see me just to check her tooth, but I asked her, the chin is swollen. We can't do anything. We can't. And at that time, if a patient comes, and then he always asks, where to go? Can you refer me to some dermatologist or a plastic surgeon? Not required. Not required. They were worried that we need a plastic surgeon just to give sutures, but she's a girl again. She will have marks. No, it's possible. The result is after 25 days. In first week, we called her twice a week, thrice in a week, then twice a week, then on third, once a week, and after 25 days, it's possible. Burn injury. A small kid. This is what photobiomodulation does for me. It heals. And the patient has only applied coconut oil, sorry, nothing else, nothing else. No painkiller, no antibiotic. Why? Let the body heal actually. So the process, as Saša has told you, it's the simple process of photosynthesis. Let there be light to heal and work. So conclusion, what is a laser? A way to patient and a clinician satisfaction. Please satisfy your patient and satisfy yourself. It can do miracles. So this is what I say, everything has a positive or a negative to it. You can find both in every single situation in the world, and the person who's going to succeed is the person who's going to be able to look at the things in a very positive manner. Still, I'm learning. It's my starting journey. And it will be a never-ending journey for me because I'm daily learning a lot. And this is what my small academy is, in the name of YAG, where we try to teach, try to learn, and share knowledge. So thank you very much for listening me and giving me opportunity. Thank you.
Thank you, Dr. Nitish Kamboj.
Thank you.
That was really a wonderful experience. You shared life journey with the lasers. Yeah, I think we still have some time left. Dr. Raju, if we have some questions, I would rather request if people can put in their questions in the chat box or raise their hand so that we can take some questions before we leave.
Thank you, Dr. Nitish and Saša. It was, both of you had given an excellent presentation. I think, if I'm not wrong, Saša was there in the IDS booth, and she spent probably about 45 minutes talking to me about the sweeps and the various modalities. So thank you, Saša. And,
you're welcome.
yeah, and that day I remember initially I was, I wanted to see something, and then I was asked to meet you, and then we spent good enough time talking about how the Fotona laser is different from other lasers. And I also had hands-on experience on the sweeps method, how acoustic cavitation can be possible with just inserting the tip of the laser in the access cavity, and you don't have to insert it really into the orifice of the canal. Thank you once again for those beautiful time we spent at the IDS Follow. And Nitish, I've always heard about you, but I think this is the first time I'm meeting you on a webinar. And I see there is a great reason why I think such a technology should be adopted at a teaching institute. As I told you, lasers always be thought that it was associated only to certain specialities, but the applications are innumerable, and as we keep applying, I mean, I was amazed to see that. I remember you showing me how a bracket could be debonded. Being an orthodontist, you said there's something for you. You showed me how a bracket could be bonded at IDS. So the applications are innumerable, lasers, and I think it would have been a very knowledgeable webinar for most of our faculty there. And, Dr. Praveen, thanks a lot. Heard a lot about your concepts of photobiomodulation and the work you've been doing in photobiomodulation. And we'll be looking forward to more interactions with you. And Jitendra ji, thanks a lot for organizing this whole program for us at the college. And I guess this is just the first step we took forward in this great association. And I'm sure some of us will definitely take up the program at the law program. I think at least one of us or a couple of us will be taking the program with the certification at the Laser Academy. I would request any of the faculty, if they have any questions, or any students, if they have any questions, they could probably either put it up the chat box, or they could actually unmute themselves and talk to the resource people. Thank you once again.
Thank you for your kind
Thank you, sir.
kindness. Thank you.
Thank you, sir.
Yeah, there's a question.
Can I read the question?
Yes.
Should the laser tip be calibrated depending on the gingival biotype, especially in case of depigmentation? I believe that you mean if we need to activate the fiber. Regarding activation and not activation is like this. If you want to have like a knife for ablating procedure, then we need to activate the fiber and we need to work in contact. But for the deep disinfection, for example, when you need to penetrate down deep into the tissue, in that case, we mustn't activate the fiber and work in non-contact. So in that case, I would say working in contact. And once you start to work in contact and the fiber tip is actually in contact with the tissue and with the chromophores, it gets activated anyway.
Saša, just I would like to understand. I mean, if it has to be erbium YAG or the soft tissue laser, which one would be a better option for depigmentation? Because I think Dr. Gautami and her team have done a lot of work on depigmentation with lasers.
For the depigmentation?
Yes.
Actually, there are pros and cons for both wavelengths. Depending on the depth of the pigments that lays in the gingiva, depending how fast you want to recover it to be. If there is some aesthetic, I don't know how to say, question, how the outcome of the surgery will be. If you want a very, very fast recovery with minimal downtime and minimal tissue damage, you will use erbium. Maybe for the procedure itself, the fastest would be with neodymium, and for the cases which there are a lot of deposit of melanin and pigments, you would use neodymium. Maybe Dr. Nitish, you would add something?
So, sir, actually, what my college and how I see these cases, that it depends upon what biotype you have. If you have a thin biotype, I always prefer to use erbium because you tend to touch the bone with NightLase. If you have a thick biotype, of course, you have a choice. You can use NightLase also. Now comes, as Saša was telling, the downtime for the healing. If a patient is having ample of downtime and patient is giving good downtime for healing, NightLase is always good, but erbium is always having the upper hand. Reason being is the collateral damage with erbium is minimum. Plus, you can really see what exactly is happening. because you can see the laser is peeling the tissue, the gingival layer by layer, and you can biostimulate the area to enhance the healing with the NDRs. It's a combination what I will prefer.
No, I agree with you, and I think Dr. Gautami and I think the team has tried different techniques. I think they use a diode laser, which is available in the institute, and they tried the scalpel method. They tried the cryo technique, and then they've used the laser also, and have seen the effect of depigmentation and how soon the depigmentation comes back. So by using neodymium laser, probably versus diode laser, do you see any difference in how soon the depigmentation comes back?
Definitely, I would say that well, the physical difference is that neodymium is a larger wavelength. Okay, diodes are mainly from 445 to 1064 also, but mainly to 980. And if you see the spectrum of absorption of diode and 1064 and neodymium is less absorbed in general, less absorbed in tissue and penetrates much deeper. Okay, this is the one big difference between diode and neodymium. The other very great difference is that neodymium work in pulse modes. Pulse modes with very short pulse duration. What this means? This means that you can achieve a very, very high peak power for ablative procedure. So it's much stronger in that way. And on the other hand, when you compare it to either chopped wave or pulse mode in diodes or continuous wave, to be more precise, it is less thermally damaging to the tissue. These are two main differences between diodes and neodymium. So the higher efficacy for cutting, on the other hand, more this tissue relaxation time in between pulses to tissue to cool down, so less heat penetration into the tissue and deeper penetration.
Thank you, Saša. And I had one more question for you. When you were talking about the cavitation in periodontal pockets, what irrigant is used? I mean, in endodontics, we know we use either hypochlorite or the EDTA. In periodontal pockets, what was the irrigant which was tried for the acoustic cavitation?
Well, actually, I've done a research. It is published article. I can send it to you. Actually, I tried to remove the biofilm that was absorbed on the titanium surfaces, and I tried citric acid, sodium hypochlorite, sorry, peroxide. They are both used, chlorhexidine. I also tried chlorhexidine and saline solution, so physiologic solution. All those four irrigation are used for disinfection in periodontal and peri-implant pocket. And actually, I didn't get much differences between them. Because I irrigate, I did the cavitation inside these irrigants and not to separate. For example, I could do the irrigation in saline solution just to mechanically destroy the biofilm and then put for 10 seconds chlorhexidine or peroxide. This would, by my opinion, would be the most sufficient solution. But the irrigation inside those irrigants did not differ in efficacy. So if you put inside the, you need to constantly irrigate. It's the same like in endodontics. It will flow away otherwise, the irrigant. If you use the saline or chlorhexidine or citric acid, what are you usually use for cleaning the periodontal pocket, the cavitation will not differ. So it will be the same for all these irrigants. And I also didn't get more disinfection with disinfectant compared to saline. It was the same because the main principles was mechanic, not chemical, you know. But I think that we should do another research. So do the cavitation in the saline and then leave it the cavitation and then just put the disinfectant solution for a few seconds to kill those bacteria that left, just to reduce the bacterial load to the minimum.
And Saša, I remember you telling me the science behind the removal of the crown, or the veneer or orthodontic bracket. For the interest of the other friends of mine, could you just explain how actually it works? Does the crown heat up, or I remember you telling me the science behind it. Just for the knowledge of the rest of them, I want you to just explain that.
So the procedure of the debonding depends on the material of actually either the veneer or the crown or the bridge. So all the prosthetic elements that we would like to remove. The less is the content of the water, the better is the penetration of the erbium throughout the veneer or the crown or the bracket. So the less is the water content, the more the energy is transmitted. It's not absorbed in the crown or in the veneer, but is transmitted through to the layer of the bonding agent that actually contains the water molecules. And this energy, this light energy, is then absorbed in these water molecules. And there is actually a micro explosion because of this absorption, and this veneer pops because of these vibrations actually that happens with the instant absorption inside the water molecules in the bonding agent. So we are influencing, so we are targeting the bonding. Nitish?
Yeah. So
is there something you would like to add?
Yeah, you are right. Actually, the main thing is the bonding agent, actually, where exactly the erbium has to be absorbed, and it removes the crown or the veneer, actually. And because anyways we are not increasing the heat, the only thing is mechanical bombardment. So this is what laser does. The lesser the water, the faster the veneer and orthodontic braces removes. This is what I've seen.
We are actually not overheating because we are, it can be some slight heating, but what we reset, so what we suggest for the procedures are the parameters that are safe. And the first thing is that we use erbium that you can adjust as a cold modality with choosing the very short pulse durations. The second is that you use water cooling along with the bonding procedure. So you are constantly delivering water on the tooth or on the veneer or crown for the cool down thing. And also the erbium does not absorb inside the composite, inside the prosthetic element, but transpasses through and is absorbed above when it enters the material. Yeah.
Well, Saša, I have an add-on question to this. We have talked about removal of brackets and removal of veneers. How about placement of brackets without the acid etching and using only the etching with the erbium laser? That's another field which a lot of people have experimented. So how is your experience with that?
Well, erbium is anyhow good for the surface modification because it actually do this micro roughness of the surface. And along with that, we have a special modality that was developed exactly for this, for modification of the surface. another great value out of this modality is that does remove also the smear layer, so there is no smear layer left, which is a reason for acid etching in conservative dentistry. Sterilized at the same time, and also, yes, surface modification. So it's when you are using this kind of modality, you are using subablative parameters. So you are not ablating, actually removing the material, removing the tissue, but just modifying in terms of irregularities, so that the bonding procedure, the bonding agent after the surface modification can have a lot more area to bond on. There are quite some studies on that, micro leakage, for example. And yeah, the surface actually, after you irradiate with this kind of modality, it shows the whitish appearance. It's the same like you were acid etching. It's very similar. Although for the enamel in conservative, it is still suggested to use both modalities, so the laser modification and reduce time for acid etching. It's not needed.
But any study on any study on the demineralization effect, because with the acid etching, you have the demineralization of the enamel.
Yes. Yeah.
But bond strength is equally good, and so it's
bond strength even higher. Yeah, depending on the study, what is focused on, but all these characteristics are confirmed for the laser. Yeah.
Yeah, for the sake of the participants, let me tell you, because we have spoken about so many procedures, but how to remember all these parameters. So nothing to worry, because LightWalker 80 has 99 plus or 90 plus procedures with the safe parameters already, provided to you, so that you can easily move from one procedure to the other. And it's a matter of time, once you start using it, in 1 week time, you get used to having a feel of, what is required, because each clinic could be different, each tooth could be different, each skin could be different. You can modify slightly these parameters, but everything is given in the presets when the laser comes to your clinic.
We have 2 more questions. If we have time, Jitendra, I don't know.
Yeah, I think let these 2 be the last 2 questions, and then we can wind up.
What is the effect on speech quality following use of the laser for apnea correction? There is actually no effect on speech whatsoever, speech quality, because it's just warming up the tissue. It's like you were drinking hot tea. There is no other side effect, because it is, how to say, it's thermally affecting the tissue to reversibly affect the collagen. So you're just losing a little bit the collagen fibers. So when the neocollagenesis and recolonization starts to happen, these fibers connect tighter. This is the background. You of course do not see this, but immediately you can feel the shrinkage. It's like a little bit like a sore throat or something similar, but absolutely no effect on the speech capabilities. Can low-level laser used for dry socket? We have different actually suggestions for dry sockets. Either direct laser irradiation, again with combining erbium and neodymium YAG, and also photobiomodulation, of course. Different approaches. I don't know, Dr. Nitish, do you have any experience with the dry socket?
So in dry socket, what we do, what we exactly use, you have to clean the socket perfectly, and you provoke bleeding with the help of erbium YAG laser. Once you provoke the bleeding with NDI laser, you can stop the coagulum. You can coagulate that blood. You can, and if the socket is too large, you just gently apply a very gentle suture and start biostimulating. It works. It works superbly. And this NDI can take care of the pain also. The main is the blood that has to come out and the stabilization of the clot. You are through with the eye socket.
Are there any protocols for photobiomodulation, especially for accelerating orthodontic tooth movement? Has any protocols come up, and how effective are these protocols for accelerated orthodontic tooth movement?
Sorry, I didn't understand the question. Sorry.
Being an orthodontist, we always talk about how to fasten the orthodontic or reduce the treatment time.
Okay. Yeah, there are studies also on that, confirming that you can fasten the movement in orthodontic processes. But I don't have any closer experience to that, so that I would know some orthodontists that would advise you in person. But I read articles about this, yeah.
So, sir, in this regard, I want to tell you one thing, that it depends what you want to do. You want to do a generalized treatment, what probe type you have, what wavelength you have, and what exactly you are trying to attain. But this is the fact. Many articles are there, what I have read, what Saša can provide you. It enhances the osteoblastic and the osteoclastic activity. Of course, it works. It works, and I have seen practically in my patient that the time duration is getting reduced and the results are getting faster. It works.
So is there a protocol for that? How
yes, sir. Actually, it depends exactly. The protocol is like photobiomodulation. You need to work in different areas. Like, what is the primary target? Whether you are planning to increase the lymphatic drainage, and what about the pain? So the protocol is you need to target the primary area where the most stress is there, or some expansion has to be taken care, and you can use a bigger device or a bigger handpiece from outside. So both intraorally and extraorally, of course, you can work. So you need to start with what I do with an extraoral, then an intraoral approach. So this is what I use.
Thank you, Nitish.
Thank you. I think that brings us to the conclusion of this wonderful session. I could see the interest, and a lot of good questions have been asked. And as Dr. Raju mentioned, this is just the beginning of it. I think we will end up somewhere where a lot of people, a lot of students, a lot of patients in that area around would be benefited with it. Thank you so much, first of all, the attendees, for spending these last 2 hours and 15 minutes with us. I know this is laser is one science which can't be finished in 2 hours, but we have raised sufficient anxiety for you to go back, research, learn, and come back to us anything which we can aid to it for your learning. And thank you, Saša, for joining us from 8,500 kilometers away from Fotona. Beautiful Slovenia, where, as I said, you fall in love with that country when you go there, and the wonderful Fotona machines, which are, means like we live and we dream with it. For us, it's a way of life, serving and working together with Fotona. And Nitish, from the base of the Himalayas, from Dehradun, it's a wonderful city to visit, and added advantages, when you visit him, you can always make a great visit to the Mussoorie Hills, wonderful hill station there. Thank you so much. Thank you everyone for making it a wonderful evening today. And let's hope to see you soon. Hope to meet soon. Enjoy your life. Good day. Thank you.
Thank you.
Thank you. Thank you.
Bye.
Bye, Saša. Bye-bye.
Bye.
Thank you.